Before we talk about the new tools we're going to discuss during this session, let's start out with a 1-minute mindfulness exercise. Close your eyes and notice where in your body you feel your breath. That might be the air going in and out of your nostrils, or the rise and fall of your chest or stomach. If you like, you can just lengthen your breath or just breathe naturally. Focus on your breath. When your mind wanders, as it will, just bring your attention back to your breath. When you notice your thoughts, just gently shepherd your attention back to your breath.
During the exercise you just did, or maybe during other recent moments of mindfulness, you may have started to notice some of your thoughts in a way you might not have before. Some of the thoughts might feel somewhat anxiety-provoking, like, I can't do this, or what's going to happen. You may have also noticed that some of the more anxious thoughts are associated with unpleasant sensations in your body, like the tightening of your jaw or your chest. What you're experiencing when you have unpleasant thoughts and feelings is the basis of a very long-standing theory about how difficult emotions arise. The basic idea is that an unpleasant thought leads to an unpleasant feeling. This is very common actually, and it happens in everyone. Although this is normal, sometimes this sequence becomes a self-perpetuating cycle, where negative thoughts lead to anxiety and other negative feelings. That then reinforces those negative thoughts, leading to even more negative feelings, and so on. These negative thoughts and feelings can lead to certain behaviors, which then make things even worse. Mindfulness, plus a technique sometimes called cognitive restructuring, can help interrupt this sequence of negative thoughts and feelings. In challenging times such as the one we're in, the cycle of negative thoughts and feelings can start to get more frequent, to the extent that it can sometimes become debilitating. This is especially important during times of uncertainty, where our minds can run wild with predictions that we can't yet make.
My wife and I are both trying to work from home. The kids are running around. They're frustrated, and we're trying to think, how long can we do this? When I start working in the hospital 80 to 100 hours a week, and she's kind of by herself, is it sustainable for her to keep her job? And then how many other Americans are kind of going through the same thing?
I think the biggest thing I've been worrying about is the safety of the people who are important to me, my colleagues, that they'll be able to protect themselves, that they'll be able to remain healthy themselves.
It's really easy to get yourself stuck in that spiral of, what if this doesn't end? What if I'm stuck out there? What if I end up transmitting it to somebody and then I have to live with that on my conscience? What if I get somebody in my, intimate family circle sick? Just that idea of not knowing and being potentially the reason that somebody else gets sick is definitely a cause for even more anxiety on top of the anxiety that we deal with in everyday life.
Let's talk about an example to try to illustrate this idea. Maria has been working at a clinic and started feeling ill. She's worried she's infected with COVID-19. Though she has not yet received her test result, she's extremely concerned about the possibility that she's infected patients, coworkers, and family members, and that they'll be furious with her. She's now thinking nonstop about whether she's infected others, how angry everyone will be with her, and whether they will forgive her or not. These thoughts are likely to cause a great deal of anxiety, shame, guilt, or fear. Although these thoughts are understandable, and she could be correct about some of her predictions, she actually has no reason to believe any of these thoughts yet. And so some of the distress she's feeling because of these thoughts may be avoidable. When we're in a cycle of negative thoughts and feelings, we can draw premature conclusions about what's happening. These premature conclusions can cause a lot of distress, even though the event we're worried about hasn't happened, or if it has, it may not have turned out the way we would have expected. Some common patterns of this type of interpreting the world are jumping to conclusions, assuming that we know something that we can't possibly know yet. For instance, Maria's making the assumption that she's tested positive and infected everyone she knows, but that may not be true. catastrophizing. Rather than thinking of all possible outcomes, sometimes our minds tend to run to the most extreme and worst case scenario. Maria's assuming that the absolute worst thing will happen and that she will be ostracized. Black and white thinking. Rather than seeing the gray middle, we only see the two extremes. Maria's only able to think, I gave it to everyone. Her mind has not made room for other possibilities. And mind reading. Making the assumption that we can know what someone else is thinking without actually checking it out with them. For instance, Maria's reading the minds of all of her coworkers by assuming they will be furious with her. Can we step back and pay attention to what the facts are telling us? Maria does not yet have enough information to make these assumptions. But by making these assumptions, she's experiencing many negative emotions. It can be hard to tolerate not knowing, but trying to predict the future can feel much worse.
Dealing with this COVID-19 has been scary for all of us. We're all worrying about a lot of things because we don't know what's going to happen. It's the unknown that scares us all so much. If we just knew, then we could process and deal with it and handle it. But not knowing is what makes us all worry.
We're all just coming back to our family and like I'm planning to take all my clothes off at the door because none of us know really what to do.
It's the unknown. We don't know what's coming, and I think that causes a lot of stress.
Pema Chodron says that sticking with uncertainty is how we learn to relax in the midst of chaos. How we learn to be cool when the ground beneath us suddenly disappears. We know that all of you are taking a lot of positive actions right now to help yourselves and to help others during this time. And for that, we're unbelievably grateful. We also know that one of the most difficult aspects of a situation like this is dealing with the things that we can't control, the parts that have no actionable items, the uncertainty that we are all experiencing. You might notice that when you're in a difficult situation like this, you adopt some strategies to deal with it. Could be that you go up into your thoughts. You might go into fix-it mode. You might notice that you check out or do something to numb yourself because it's just too overwhelming. You might notice that you go into blaming mode, and that could be of yourself. Why didn't I do enough? I should have done something different. Or someone else. Why didn't this person do something different? This person is to blame. This country, this state of the world. These are all strategies that we use to help us to deal with the discomfort of uncertainty and all the feelings that arise with that. And while there are some at least short-term benefits to these strategies, they leave us more cut off from ourselves and others and less able to effectively deal with the situation at hand. So for this, we might practice being with the uncertainty as it arises, neither resisting it nor fueling it, because resisting the feelings it evokes will only make them stick around longer. So I'd invite you to think of an aspect of what is going on that is causing you some distress. Maybe it's a worry about yourself or your loved one's health. Maybe it's a fear about your economic situation. Maybe about the world or our global neighbors. Notice and name the thought or thoughts that are associated with this situation. I am afraid that blank. What if blank happens? Try putting the fear into a sentence. Notice how you are relating to this thought. Are you seeing it as a fact? Could you observe the thought as a thought, neither agreeing with it nor disagreeing with it, holding it lightly? And could we dip below the level of the thoughts to the part that is experiencing the vulnerability, the uncertainty? It could be a scared part that we're trying to escape from. You may notice how the vulnerability, the scared part, is coming up in your body. How does it feel? Is it tense? Is it jittery? Can we be with this vulnerable, scared part? Not running away from it, fighting it, feeding it. Acknowledging it. It's already here. Allowing it to be here. Relating to it with kindness. Might we accompany this vulnerable part of ourselves rather than leave it to fend for itself or go into strategies to manage the fear that often serves to disconnect us? Of course, there are times that we can act and specific things that we can do, and during those times, let's do those things. And there are many things that feel uncertain and out of control, and we go into our fear response. And during these times, I'd invite you to view your thoughts as thoughts, not as facts, and acknowledge that there is a real fear that needs your kind attention.
We want to begin the process of questioning our interpretations and conclusions. This involves being flexible when thinking about other people's intentions. Sometimes this is called mentalization. When we mentalize, we're trying to imagine in a flexible way what other people are thinking without making too many assumptions. If you like, pause for a moment and think about an upsetting interaction you've had during this outbreak. Now try to think about alternative explanations for what you assumed happened. They don't have to be more positive or optimistic, just different from the first explanation you came up with. Was that difficult to do? If you were able to do this, how did it make you feel?
It's important to remember that when people are under a lot of stress, their ability to think flexibly about their own perceptions and beliefs or the motivations behind other people's actions can be much lower than normal. This is because when stress becomes intense, it can activate the fight or flight response in us. This is the basic survival response of the brain and body that most animal species have. It involves increases in chemicals in the body such as adrenaline and cortisol, which makes us more alert and focused and ready to act. This system helps us focus our attention on potential dangers in our environment so that we can combat those dangers and survive. Once we get into our automatic fight or flight mode, we are often unable to think constructively about our situation. This is when we start making those assumptions and predictions that we don't yet have enough information to make. And it comes hand in hand with physical symptoms of anxiety, such as feeling jittery, sweating, feeling your heart race or palpitate. When we are in that mode, we need to first bring our stress levels back down. We can do this by trying to use a mindfulness technique, talking to someone else whom we trust, taking a walk outside, or even listening to music. We might need to pause for several minutes or even hours before we can get into a clear enough state of mind to think about the situation from all sides.
This session focused on understanding how worries and negative feelings can sometimes reinforce each other, and that it's helpful to not always take your thoughts and feelings at face value. We can use mindfulness to recognize that our thoughts are not necessarily facts, and that we sometimes jump to conclusions without having enough information. It's sometimes easier to decide that we know what's going to happen or what a person intended than to accept that we just don't know. We also talked about mentalization, the ability to be flexible when interpreting the behavior of others. So let's now just pause for a moment to think. What can you use from what you've just heard?